Female genital cancers are becoming increasingly common. And what is more worrisome about this is that they are beginning to occur in younger women and they will show no sign at the earliest stages. Cancer of the cervix is the fourth most common cancer in women, and for decades, the cause of cervical cancer was unknown. But today there is good news because we now know what causes cervical cancer and we know how it can be prevented. Hi ladies, I'm Dr. Jides, community physician and public health specialist. Welcome to my channel where we discuss women's health and lifestyle. And welcome to my genital cancer series. Today we are going to be talking about the cancer of the cervix. But before we get into that, please hit the like button, subscribe, and share this video with your friends and any woman within the reproductive age whom you know would benefit from this video. So let's get right into it. So what is cervical cancer? Cancers are simply tumors or abnormal growths. Cancer of the cervix is the cancer that occurs within the cells of the cervix. Now, the cervix is the lower part of the uterus that connects the vagina to the womb and is usually referred to as the neck of the womb. Cancer occurs when the cells of the cervix grow out of control and they develop into abnormal cells which are called cancers. So for many years, the specific cause of cervical cancer was unknown. What we knew were the risk factors. And risk factor simply means that the chances of a disease occurring are higher when these factors are present. But that doesn't necessarily mean that these factors are the cause of the disease. So for cervical cancer, we knew that it is more likely to occur in women with multiple sexual partners. So the more sexual partners a woman has, the higher the chances of acquiring sexually transmitted infections and acquiring the human papillomavirus. We also know that cervical cancer is more likely to occur in women who started having sex early, and that is before the age of 16. Having sex at an early age before 16 years increases your risk of contacting the human papillomavirus. Women who have sex with uncircumcised male partners, women infected with other sexually transmitted infections such as chlamydia, gonorrhea, syphilis, HIV/AIDS, and any other condition that makes it hard for your body to be able to fight off disease. Women who have a weakened immune system, you are more likely to contract cervical cancer if your immune system is weakened by another health condition. Women who smoke, smokers die young, right? Women who are on prolonged use of oral birth control pills. Exposure to a certain type of miscarriage prevention drug. If your mother took a drug called diethylstilbestrol while pregnant in the 1950s, then you may be at an increased risk of a certain type of cervical cancer known as clear cell adenocarcinoma. And this was what we knew about women who had cervical cancer. So a few years ago, medical scientists discovered the cause of cervical cancer. And guess what? Cancer of the cervix is caused by none other than this guy here. Yeah, meet the human papillomavirus, HPV, the most common sexually transmitted infection in the world with over 100 different strains. This is the cause of cervical cancer. And the medical community came to this conclusion when they discovered that the HPV was present in over 95% of cases of cervical cancer. That is to say, if there are 10 women with cancer of the cervix, at least 9 of them were infected with the human papillomavirus. And if you can isolate a particular organism in almost every case of a disease, then you can authoritatively say that that organism is the cause of that disease. So what is this HPV? HPV is a sexually transmitted infection and it is very common. According to the Center for Disease Control, CDC, the human papillomavirus is the most common sexually transmitted infection in the world. It is so common that almost every sexually active person must have contracted HPV at some point in their life, even if they have only one sexual partner. But the good news is all this variety of HPV vaccines do not cause health problems. In fact, majority of them do not cause health problems. Most of the health problems are caused by HPV type 6, 11, 16, and 18. HPV type 16 and 18 are responsible for most cases of cervical cancer. Remember, we say that there are over 100 varieties of HPV and so many of them are harmless, and that is because the body has a way of getting rid of them. However, in a small percentage of people, the body's immune system cannot get rid of this virus, and this virus survives and lingers for years in the cervix and then causes the normal cervical cells to become abnormal and then turn into cancer cells. And HPV causes not just the cancer of the cervix, they also cause cancer of the anus, cancer of the throat, and some of them lead to development of genital warts. So doctor, does it mean cervical cancer is sexually transmitted? Well, it can be. Let me know in the comment section if that came as a surprise to you. So what are the symptoms of cancer of the cervix? In the early stage of cervical cancer, there are usually no symptoms, there are usually no signs, but later on, symptoms may include vaginal bleeding after sexual intercourse, bleeding in between periods, bleeding after the menopause, watery, bloody vaginal discharge that may be heavy or sometimes have a foul odor. There could be pelvic pain, pain during intercourse. If you experience one or more of these symptoms, then you may need to pay a visit to your doctor. How can I prevent cervical cancer or at least reduce my risk? The first and most important thing you can do to reduce your risk of cervical cancer is to conduct regular screening for cervical cancer. And screening is done among women who have no symptoms and may feel perfectly healthy. And there are two screening tests that can help detect cervical cancer early. The first is the pap smear and the second is the HPV test. And this is commonly recommended by the World Health Organization. The pap smear or the HPV test can detect cervical cancer at the initial or very early stage. That is what we call the pre-cancerous stage, and at which stage it can be treated completely and prevented from progressing to cancer. So the recommendation is from the age of 30 years, every woman should have a pap smear or HPV test, which should be repeated every 5 to 10 years. For HIV patients, the WHO recommends that screening should be started earlier from 25 years and repeated every 3 to 5 years. Since it was established that the HPV caused cervical cancer, a HPV vaccine was developed and is currently available in every country. Women from 9 years to 45 years can take the HPV vaccine. However, there are some restrictions to the vaccine in some countries, so you need to find out what is obtainable in your country. Remember that the HPV is sexually transmitted, so the HPV vaccine works best if it's administered before one is exposed to the HPV, and that is before a woman becomes sexually active. So it's generally recommended to vaccinate girls between the ages of 9 years to 14 years, and that is when most girls have not started sexual activity. Please ask your doctor whether a HPV vaccine is appropriate for you, considering what is obtainable in your country. Again, practice safe sex, and this means preventing yourself from getting infected with a sexually transmitted infection. And the only thing that can do this for you is to use a condom during sexual intercourse. Finally, do not smoke. If you already do not smoke, do not start. If you already do smoke, please see your doctor to discuss strategies that can help you quit. And this brings me to the end of this video. Thank you for watching. I hope this video was useful. If you like this video, please hit the like button and share it. Share it to your friends, share it to every woman you know may benefit from it. And it will make my day if you subscribe to this channel, and that will encourage me to make more videos. And of course, comment below and I'll be happy to answer any questions you may have. And always remember, your health matters. Goodbye.